What happens when the most powerful man in the city becomes completely powerless? When the billionaire who built an empire on cutting costs suddenly needs the very people he's been underpaying to save his life. This is the story of Marcus Blackwell, a name that commanded respect and fear in equal measure across the business world. At 52, he had built Blackwell Medical Group from a single clinic into the largest healthcare network in the state. 15 hospitals, over 10,000 employees, and a personal net worth that placed him among the top 1% of the 1%. But Marcus had a philosophy that made him both incredibly wealthy and deeply despised. Every dollar saved is a dollar earned. He applied this ruthlessly to everything, especially his employees' wages. While his hospitals generated billions in revenue, his nurses worked double shifts for barely livable wages. His janitors qualified for food stamps. His security guards took second jobs just to pay rent. They should be grateful to have jobs at all. Marcus would tell his board of directors, adjusting his $15,000 watch. Healthcare is a business, not a charity. The irony was lost on him that he'd built his fortune on the backs of people dedicated to healing others, while he seemed incapable of healing the growing resentment within his own organization. Employee turnover was astronomical. Union organizers circled like vultures. Local news stations ran exposés about the billionaire who wouldn't pay living wages. But Marcus didn't care about public opinion. He cared about profit margins, stock prices, and the quarterly reports that made his investors smile. He lived in a $40 million penthouse, drove cars worth more than most people's houses, and surrounded himself with people who told him exactly what he wanted to hear. Until one ordinary Tuesday morning changed everything. Marcus was in his corner office on the 42nd floor, reviewing cost-cutting proposals that would eliminate another 200 jobs when the first wave of dizziness hit him. He gripped his mahogany desk, assuming it was just fatigue from his 18-hour workdays. The second wave brought nausea. The third brought crushing chest pain that dropped him to his knees. His assistant found him unconscious 20 minutes later. The ambulance rushed him to the closest hospital, which happened to be Mercy General, the flagship facility of his own medical empire. As the paramedics wheeled him through the emergency room doors, Marcus was about to discover what it felt like to be completely dependent on the very people he'd spent years treating as expendable. But here's what makes this story truly extraordinary. It's not just about a rich man learning humility. It's about the incredible power of human compassion, even in the face of injustice. It's about a group of healthcare workers who had every reason to provide the bare minimum care to their boss, and chose to do something completely different instead. Over the next hour, you're going to witness a transformation that will challenge everything you think you know about forgiveness, redemption, and what it really means to be wealthy. You'll meet the night shift nurse who had been evicted from her apartment because of low wages, yet stayed by Marcus's bedside through his darkest hours. The janitor who worked 3 jobs to support his family, but still took time to comfort a frightened billionaire. The young doctor drowning in student debt, who made a choice that would change both their lives forever. This isn't a fairy tale where everything magically gets better. Real change is messy, complicated, and sometimes painful. But it's also possible, even for someone who seemed beyond redemption. So buckle up, because you're about to discover what happens when a man who thought money could buy everything learns that the most valuable things in life can't be purchased at any price. And trust me, by the end of this story, you'll never look at wealth, power, or the people who serve us the same way again. Marcus Blackwell had always believed that control was everything. Control over his emotions, his business, his employees, and especially his image. But as he lay unconscious on a gurney being rushed to the halls of Mercy General, control was the one thing he no longer possessed. The irony wasn't lost on the staff, who recognized him. Word spread quickly through the hospital corridors. Their notoriously stingy boss was now completely at their mercy. Some whispered that it was karma. Others wondered if this might finally be the wake-up call he needed. But most were too professional, too dedicated to their calling, to let personal feelings interfere with patient care. Dr. Sarah Chun was the attending physician who took charge of Marcus's case. At 34, she was brilliant, overworked, and drowning in student debt that would take her another 15 years to pay off. partly because Blackwell Medical Group's salary structure kept even their doctors' wages artificially low compared to other hospital systems. She had been considering leaving for a position in California that paid 40% more, but something about this moment made her stay focused on the task at hand. Massive myocardial infarction. She announced to her team as they worked to stabilize him. Get me a full cardiac panel and prep for emergency catheterization. As the medical team sprang into action, Marcus began to regain consciousness. The first thing he saw was a concerned face of Maria Santos, a night shift nurse who had been with the hospital for 12 years. Maria was a single mother of 3 who had been evicted from her apartment just 2 months earlier because her wages couldn't keep up with rising rent costs. She now lived with her children in her sister's cramped 2-bedroom apartment, working double shifts when never possible to save money for a new place. "Mr. Blackwell, you're in the hospital," Maria said gently, checking his vital signs. "You've had a heart attack, but you're going to be okay. We're taking good care of you." Marcus tried to speak, but the oxygen mask made it difficult. His eyes darted around the room, taking the faces of people he had never really seen before, despite the fact that they had been working in his hospitals for years. There was James Rodriguez, the night janitor who cleaned these very floors while working 2 other jobs to support his elderly parents and disabled brother. There was Patricia Williams, the security guard who had been asking for a raise for 3 years to help pay for her daughter's college tuition. For the first time in his adult life, Marcus was completely vulnerable. He couldn't bark orders, couldn't threaten anyone's job, couldn't use his wealth or position to get what he wanted. He was just another patient, dependent on the skill and compassion of people he had systematically underpaid and undervalued. Dr. Chin returned with the test results, her expression serious but not panicked. "Mr. Blackwell, you've suffered a significant heart attack. We need to perform an emergency procedure to open the blocked artery. The good news is that we caught it in time, but you're going to need surgery, followed by several days of intensive care and then a longer recovery period." As they wheeled him toward the cardiac catheterization lab, Marcus caught glimpses of the hospital he thought he knew so well. But now he was seeing it from a completely different perspective. He noticed the worn linoleum floors that James mopped every night, the outdated equipment that his cost-cutting measures had prevented from being replaced, the tired faces of staff members pulling double shifts because there weren't enough employees to maintain proper coverage. The procedure was successful, but Marcus's real education was just beginning. When he woke up in the cardiac intensive care unit, he found himself in a world where his money and power meant nothing. Here, what mattered was the dedication of people like Maria, who checked on him every hour despite being exhausted from working 16-hour shifts. It was the expertise of Dr. Chun, who had stayed late to monitor his recovery even though she wasn't being paid overtime. It was the gentle care of James, who took extra time to ensure his room was spotless and comfortable. But Marcus wasn't ready to learn these lessons yet. As his strength returned, so did his arrogance. "I want a private room," he demanded on the second day, his voice still weak but his tone unmistakably imperious. "And I want my personal physician flown in from Johns Hopkins." Maria looked up from adjusting his Ford drip, her expression patient but firm. "Mr. Blackwell, you're in the best cardiac unit in the state. Dr. Chun is one of the finest cardiologists you'll find anywhere. And as for a private room, we're at capacity right now. You're receiving the same excellent care as every other patient. Do you know who I am?" Marcus asked, the familiar phrase that had opened doors and bent people to his will for decades. "Yes, sir, I do," Maria replied quietly. "You're a patient who needs to rest and recover. That's all that matters right now." It was a response that would have gotten any other employee fired on the spot. But here, in this hospital bed, Marcus was learning that there were some things his authority couldn't touch. The dedication of healthcare workers to their patients transcended workplace politics, personal grievances, and even justified anger. Over the next few days, as Marcus drifted in and out of consciousness, he began to overhear conversations he was never meant to hear. Nurses discussing how they were rationing their own medications because they couldn't afford them. Doctors talking about leaving for better opportunities. Support staff working multiple jobs just to survive. And slowly, very slowly, something began to crack in the armor of Marcus Blackwell's certainty about the world he had built. By his fourth day in the cardiac unit, Marcus was stable enough to stay awake for longer periods. What he discovered during those wakeful hours would haunt him for the rest of his life. It started with the patient in the bed next to him, an elderly man named Robert who had worked as a maintenance supervisor at one of Marcus's smaller hospitals for 37 years. Robert was dying, and his family couldn't afford to take time off work to be with him because the hospital's benefits package didn't include adequate bereavement leave or family medical leave. Marcus watched through the thin curtain as Robert's daughter, Linda, visited during her lunch break from her job at a grocery store. She held her father's hand for exactly 30 minutes before rushing back to work, tears streaming down her face. "I'm sorry, Dad," she whispered. "I can't lose this job. The kids need insurance." Robert squeezed her hand weakly. "I understand, sweetheart. You do what you have to do." After Linda left, Marcus heard Robert crying softly. It was a sound that cut through him in a way that quarterly reports and profit margins never had. Here was a man who had dedicated nearly 4 decades of his life to keeping Marcus's hospitals running, and he was dying alone because his family couldn't afford to be there. Maria noticed Marcus staring at the curtain. "Mr. Patterson is a good man," she said quietly as she checked his blood pressure. He trained half the maintenance staff in the system, never missed a day of work until he got sick. "Why isn't his family here?" Marcus asked, though he suspected he already knew the answer. Maria's jaw tightened almost imperceptibly. "They can't afford to take unpaid leave, and our bereavement policy only covers 3 days for immediate family. Mr. Patterson has been here for 2 weeks. The weight of that statement settled over Marcus like a heavy blanket. His cost-cutting measures had created a system where loyal employees couldn't even be with their dying loved ones. He had never considered the human cost of his efficiency measures. That night, Marcus couldn't sleep. He listened to the sounds of the hospital, the soft footsteps of nurses making their rounds, the quiet conversations at the nurse's station, the occasional beep of monitors. But what struck him most was what he didn't hear. Complaints about him. Despite having every reason to provide substandard care, despite years of being undervalued and underpaid, the staff was treating him with the same dedication they showed every patient. Dr. Chin checked on him personally during her rounds, even though she could have delegated his care to residents. Maria stayed past her shift to ensure his medication schedule was properly coordinated with the day nurse. Even James, a janitor, took extra care when cleaning his room, making sure not to disturb his rest. The next morning brought a conversation that would change everything. Dr. Chin was reviewing his chart when Marcus finally worked up the courage to ask the question that had been bothering him. "Dr. Chin, can I ask you something?" She looked up, her expression professional but not unkind. "Of course. Why are you all taking such good care of me? I mean, I know why professionally, but..." He struggled to find the words. "I haven't exactly been generous with salaries or benefits." Dr. Chin was quiet for a long moment, considering her response. When she spoke, her voice was measured but honest. "Mr. Blackwell, I became a doctor to help people. Not just the people who can afford premium care, not just the people who treat their employees well, but all people. When you're lying in that bed, you're not a billionaire or CEO. You're a human being who needs medical care. That's what matters to me." She paused, then continued, "But I'll be honest with you. It would be easier to provide that care if we weren't constantly worried about making ends meet. If we didn't have to choose between buying groceries and filling our own prescriptions. If we could focus on medicine instead of wondering whether we'll be able to pay our student loans or afford childcare." It was the most direct criticism anyone had ever given Marcus, and it hit him harder than his heart attack had, because it wasn't delivered with anger or resentment. It was delivered with the quiet dignity of someone who had chosen to rise above circumstances that would have broken lesser people. That afternoon, Marcus witnessed something that shattered his worldview completely. A young mother brought her sick child to the emergency room, but she didn't have insurance and couldn't afford the treatment. Marcus watched from his wheelchair. He was finally strong enough for short trips around the unit, as Dr. Chin and the nursing staff worked together to find ways to provide care anyway. They used samples of medications instead of prescriptions the family couldn't afford. They classified the visit in a way that would minimize costs. They spent their own time researching charity programs and payment plans. They turned what should have been a simple business transaction into an act of compassion. And Marcus realized that this happened every day in his hospitals. His employees were constantly finding ways to work around the financial barriers he had created, using their own resources and time to ensure that people received care. They were doing the job he should have been doing as the owner of a healthcare system, making sure that healing was accessible to everyone who needed it. That evening, as Maria was finishing her shift, Marcus called her over to his bed. "Maria, can I ask you something personal?" She nodded, though her expression was cautious. "I heard that you were evicted from your apartment. Is that true?" Her cheeks flushed, but she maintained her composure. "Yes, sir, but it's not affected my work performance." "That's not what I'm worried about," Marcus said quickly. "I'm worried about you, about your children. Where are you living now?" "We're staying with my sister temporarily. It's crowded, but we're managing." Marcus felt something he hadn't experienced in years. Shame. Deep, burning shame that made his chest tight in a way that had nothing to do with his heart condition. "How long have you been working here, Maria?" 12 years, sir." "And in 12 years, have you ever called in sick when you weren't actually sick? Ever been late without a good reason? Ever provided anything less than excellent patient care?" Maria looked confused by the questions. "No, sir. This job means everything to me." "Then why?" Marcus asked, his voice barely above a whisper. "Why haven't I been paying you enough to keep a roof over your head?" It was a question that hung in the air between them, heavy with implications that neither of them was quite ready to address. But it was also the first crack in the wall that Marcus had built around his conscience, and the beginning of a transformation that would surprise everyone, including himself. Marcus's recovery took an unexpected turn on his 7th day in the hospital. What was supposed to be a routine checkup revealed complications that would extend his stay indefinitely. A blood clot had formed near the surgical site, requiring additional procedures and putting him at risk for another heart attack. "I'm afraid you're going to be with us for at least another 2 weeks," Dr. Chen explained, her tone professional but not unsympathetic. "We need to monitor you closely and adjust your medication regimen." For a man accustomed to controlling every aspect of his environment, the news was devastating. But for the hospital staff, it meant something else entirely. 2 more weeks of caring for a man who had made their professional lives unnecessarily difficult, yet who was slowly becoming more human in their eyes. The extended stay gave Marcus something he had never had before, time to truly observe the world he had created. And what he saw horrified him. He watched Maria work 3 consecutive double shifts because the hospital was short-staffed and she needed the overtime pay. By the 3rd day, she was so exhausted she could barely stand, but she never let it affect her patient care. When Marcus asked her why she didn't just go home, her answer was simple. "People need care, Mr. Blackwell, and I need the money." He observed Dr. Chen eating vending machine dinners in the break room because she couldn't afford to eat at the hospital cafeteria regularly, despite being one of the most skilled cardiologists in the state. When he mentioned this to her, she laughed it off. "Medical school loans don't pay themselves," she said. "I'll eat real food when I'm debt-free in about 15 years. But it was James, the night janitor, who provided the most eye-opening experience. One evening, as Marcus was taking his prescribed walk around the unit, he found James in the supply closet, quietly crying. "James, are you all right?" The older man quickly wiped his eyes, embarrassed to be seen in such a vulnerable state. "I'm fine, Mr. Blackwell. Just tired." But Marcus didn't walk away. Something about his time in the hospital had made him more attuned to human suffering, perhaps because he had experienced it himself for the first time in decades. "What's wrong?" he asked gently. James hesitated, then seemed to decide that honesty couldn't make his situation any worse. "My brother Miguel, he's got diabetes. Real bad. He needs insulin, but his insurance doesn't cover the kind he needs, and we can't afford to pay for it ourselves. I've been working 3 jobs, but still not enough. What happens if he doesn't get the insulin?" "He dies," James said simply. "The doctor says he's got maybe a month without proper treatment." Marcus felt a familiar tightness in his chest, but this time it wasn't his heart condition. It was the crushing weight of understanding that his business decisions had real, life-and-death consequences for real people. "How much does the insulin cost?" About $800 a month. Might as well be $8 million for someone like me. $800. Marcus spent more than that on a single dinner at his favorite restaurant. He had watches that cost more than James made in a year. And here was a man who had worked faithfully in his hospitals for over a decade, facing the prospect of watching his brother die because he couldn't afford medication. That night, Marcus couldn't sleep. He kept thinking about Miguel Rodriguez, a man he had never met, but whose life hung in the balance because of systems Marcus had created. He thought about Maria's children, sleeping on air mattresses in their aunt's living room. He thought about Dr. Chun, one of the most brilliant people he had ever met, eating processed food from vending machines because she couldn't afford better. The next morning, Marcus made a decision that surprised everyone, including himself. He called his personal attorney. "Richard, I need you to set up a meeting with my board of directors. Here at the hospital, Marcus, you're supposed to be recovering. Can't this wait until you're discharged?" "No, it can't wait." "And Richard, I also need you to research something for me. I want to know the average salary for hospital employees in comparable systems across the country. Not just doctors. Everyone. Nurses, technicians, support staff, janitors, security guards. Everyone. What are you planning, Marcus?" "I'm planning to fix something that should never have been broken in the first place." The board meeting took place in the hospital conference room 3 days later. Marcus, still weak but determined, faced the 12 men and women who had helped him build his empire on the principle of maximum profit and minimum expense. "Gentlemen, ladies," he began, his voice still not at full strength but carrying unmistakable authority. "I've been doing some research during my recovery. Did you know that our nurses make an average of $15,000 less per year than nurses at comparable hospitals? That our support staff qualifies for government assistance programs despite working full-time jobs?" Board member Patricia Hawthorne, a sharp-eyed woman in her 60s, frowned. "Marcus, we discussed this before. Our competitive advantage has always been our cost structure. If we raise wages significantly, we'll lose our edge in the market." "What edge?" Marcus asked. "The edge that allows us to profit from human suffering? The edge that forces our employees to choose between paying rent and buying groceries." The room fell silent. This was not the Marcus Blackwell they knew, the man who had once famously said that compassion's expensive and we're not in the charity business. CFO David Chun, no relation to Dr. Sarah Chun, pulled out his tablet. "Marcus, if we were to bring all our employees up to market rate salaries, we're looking at an additional expense of approximately $200 million annually. That would cut our profit margins by nearly 30%. And what would that leave us with, David? Still the most profitable hospital system in the region, but nothing," Marcus interrupted. "We would still be profitable. We would still be successful. We would just be successful without destroying the lives of the people who make our success possible." Board member Thomas Wright, a longtime friend and early investor, leaned forward. "Marcus, I think your illness might be affecting your judgment. This is a radical departure from everything we've built together." "You're right, Thomas. My illness has affected my judgment. It's helped me see clearly for the first time in years." Marcus looked around the room at faces that had once seemed like allies, but now felt like obstacles to doing what was right. "I'm calling for an emergency vote to restructure our entire compensation system. Every employee, from the newest janitor to the most senior physician, will receive a salary adjustment that brings them to at least a median wage for their position in comparable markets. We'll also be implementing comprehensive benefits, including full health care coverage, adequate paid time off, and family leave policies that actually allow people to care for their loved ones." The room erupted in protests and objections, but Marcus held up his hand for silence. "This isn't a discussion. This is happening. The only question is whether you want to be part of a healthcare system that actually cares about the people who work for it, or whether you want to find other investment opportunities." It was a declaration of war against everything his empire had been built on. But as Marcus looked out the conference room window at the hospital bustling with activity below, he realized that some wars were worth fighting, especially when the stakes were measured in human dignity rather than stock prices. The board meeting ended in chaos. 3 members resigned on the spot, calling Marcus's proposal financial suicide. Two others threatened legal action to prevent what they termed the destruction of shareholder value. Only a handful seemed willing to even consider the radical restructuring he was proposing. But Marcus had learned something during his time as a patient. Sometimes the right thing to do is also the hardest thing to do, and he was prepared for the fight of his life. The news of his proposal leaked within hours. By the next morning, financial news networks were running stories about the billionaire's breakdown and speculating about hostile takeovers. Stock prices for Blackwell Medical Group plummeted. Investors demanded emergency meetings. The business press painted him as a man who had lost his mind along with his health. But something unexpected happened in the hospitals themselves. Word spread among the staff about what Marcus was trying to do, and the response was unlike anything he could have anticipated. Dr. Chen stopped by his room that evening, her expression unreadable. "Mr. Blackwell, I heard about the board meeting." Marcus braced himself for criticism, for the practical objections that everyone else had raised. Instead, Dr. Chen sat down in the chair beside his bed. "I want you to know that what you're trying to do, it matters, not just financially, but because it shows that you see us as human beings, not just line items on a budget. The board thinks I've lost my mind. Maybe you have," she said with a slight smile. "But maybe that's not such a bad thing. The mind you had before wasn't working very well for anyone except you." Over the next few days, Marcus received visits from employees throughout the hospital system. They came during their breaks, after their shifts, whenever they could find a few minutes. They didn't come to thank him. The changes hadn't been implemented yet and might never be if the board had their way. They came to tell him their stories. Patricia Williams, the security guard, told him about her daughter who had been accepted to medical school but couldn't afford to attend. "She's working at a fast food restaurant now, trying to save money. Breaks my heart to see her dreams on hold because we can't afford the tuition." Carlos Mendoza, a respiratory therapist, explained how he had been rationing his own asthma medication because he couldn't afford both a prescription and his son's school supplies. "I help people breathe all day," he said with bitter irony, "but I can't afford to breathe properly myself." Jennifer Park, a young nurse fresh out of school, broke down crying as she described living in her car for 3 weeks between paychecks because she couldn't afford both rent and student loan payments. "I became a nurse to help people," she sobbed. "I never thought I'd be homeless while working full-time in a hospital." Each story was a dagger to Marcus's conscience, but they also strengthened his resolve. These weren't abstract numbers on a spreadsheet. They were real people whose lives had been diminished by his pursuit of profit. The resistance to his plan intensified. A group of major investors, led by his former friend Thomas Wright, began organizing a campaign to remove him as CEO. They argued that his emotional instability, following his heart attack, made him unfit to lead the company. "Marcus has clearly suffered some kind of psychological break," Wright told Financial News reporter. "His proposal would bankrupt the company within 5 years. We have a fiduciary responsibility to prevent this disaster." The legal battles began in earnest. Injunctions were filed to prevent any salary increases. Emergency shareholder meetings were called. Marcus found himself fighting for control of the company he had built, all while still recovering from major cardiac surgery. But he wasn't fighting alone. Something remarkable was happening among the hospital staff. They were organizing not just as employees demanding better wages, but as healthcare professionals who believed in the mission Marcus was trying to articulate. Dr. Chen became an unofficial spokesperson for the movement. She appeared on local news programs, articulating connection between employee welfare and patient care. When nurses are working 3 jobs just to survive, when doctors are too exhausted from financial stress to focus properly, when support staff can't afford to take sick days, that affects patient care, she explained to a television interviewer. "Mr. Blackwell isn't just trying to help his employees. He's trying to create a healthcare system that actually works for everyone." Maria organized a petition signed by over 8,000 employees across the hospital system, supporting Marcus's proposed changes. The petition didn't just ask for higher wages. It outlined how better compensation would improve patient care, reduce turnover, and create a more stable healthcare environment. Even James, the quiet janitor who rarely spoke about anything, found his voice. He testified at a city council meeting about the connection between employee wages and community health. When hospital workers can't afford to live in the communities they serve, when we're too worried about our own family survival to focus on our jobs, everyone suffers, he said, his voice shaking with emotion. Mr. Blackwell is trying to fix something that's been broken for too long. The public support was overwhelming, but the financial pressure was intense. Stock prices continued to fall. Credit rating agencies threatened to downgrade the company's bonds. Several major investors pulled out entirely, creating a cash flow crisis that threatened the entire operation. Marcus's personal physician, flown in from Johns Hopkins as he had originally demanded, delivered sobering news during a private consultation. Your stress levels are dangerously high, Marcus. Your blood pressure is spiking, and I'm seeing irregularities in your heart rhythm that concern me. If you don't find a way to reduce the pressure you're under, you could have another heart attack, and this one might be fatal. So what are you suggesting, Dr. Morrison? That I abandon the people who saved my life. I'm suggesting that you consider whether dying for this cause is really the best way to help them. It was a question that haunted Marcus through another sleepless night. Was he being noble, or was he being foolish? Was he fighting for justice, or was he simply trying to assuage his guilt? And if he died in this battle, would it help anyone, or would it just allow the old system to continue unchanged? The answer came from an unexpected source. The next morning, he found a handwritten note that had been slipped under his door during the night. It was from Robert Patterson, the dying maintenance supervisor in the bed next to him. Mr. Blackwell, the note read in shaky handwriting, I heard about what you're trying to do. I want you to know that in 37 years of working for this company, no one in management ever asked me what I needed or how they could help. You're the first. Don't give up. Some fights are worth having, even if you don't win. But I think you're going to win this one. And when you do, remember us little people who believed in you when nobody else did. Robert had died peacefully in his sleep just hours after writing the note. His family, finally able to take time off work thanks to an emergency fund that Marcus had quietly established, was with him at the end. As Marcus held that note, he realized that this fight wasn't about him anymore. It wasn't about his guilt or his redemption or his legacy. It was about creating a world where people like Robert Patterson could die with dignity, surrounded by a family who didn't have to choose between being present and paying bills. The war for the soul of Blackwell Medical Group was far from over, but Marcus finally understood what he was really fighting for and why he couldn't afford to lose. 3 weeks after his heart attack, Marcus was finally strong enough to be discharged from the hospital, but he wasn't the same man who had been wheeled through those emergency room doors. The physical recovery was remarkable. Dr. Chin declared his progress exceptional and cleared him for light activities. The emotional and spiritual transformation was even more profound. On his last morning as a patient, Marcus did something that surprised everyone. He asked for a meeting with the entire night shift staff, not in a conference room or his office, but right there in the cardiac unit, where he had learned the most important lessons of his life. They gathered around his bed at 6 a.m., nurses, technicians, janitors, security guards, and support staff who would care for him during his most vulnerable weeks. Many looked tired from their long shifts, but they came because something about this moment felt historic. I want to start by saying something I should have said years ago, Marcus began, his voice stronger than it had been since his heart attack. Thank you, not just for saving my life, but for showing me what it means to be truly wealthy. He looked around the room at faces that had become familiar, people who had been invisible to him for years, but who were now the most important people in his world. I spent decades believing that success meant accumulating money and power. I thought that being tough meant being heartless, that being profitable meant being ruthless. I was wrong about everything. Maria stepped forward, her expression cautious but hopeful. Mr. Blackwell, we heard about the legal battles, about the investors trying to remove you. What's going to happen? Marcus smiled, a genuine expression that few people had ever seen from him. What's going to happen is that we're going to win, not because I'm powerful or wealthy, but because what we're fighting for is right. And because I've learned that the most powerful force in the world isn't money. It's people who care about each other. He reached into his bedside table and pulled out a folder thick with legal documents. These are the papers I'm signing today. Regardless of what the board decides, regardless of what the investors do, I'm implementing immediate salary increases for every employee in this hospital system. The money is coming from my personal accounts, not company funds, so no one can stop it. The room fell silent. Dr. Chin was the first to speak. Mr. Blackwell, that's incredibly generous, but it's not sustainable long term. You can't personally fund salary increases for 10,000 employees indefinitely. You're right, Marcus agreed, which is why I'm also announcing that I'm restructuring my ownership of the company. I'm transferring 40% of my shares to an employee ownership trust. Every person who works for Blackwell Medical Group will become a part owner of the company they help run. The implications of this announcement rippled through the room. James, the janitor who had worked 3 jobs to support his family, would now own a piece of one of the largest healthcare systems in the state. Maria, who had been evicted from her apartment, would have a voice in company decisions. Dr. Chun, drowning in student debt, would share in the profits she helped generate. But that's not all, Marcus continued. I'm also establishing the Patterson Foundation, named after Robert Patterson, who died in the bed next to mine and taught me more about dignity in death than I had learned about dignity in life. The foundation will provide emergency financial assistance to any employee facing hardship, educational scholarships for employees' children, and comprehensive health care coverage that includes mental health services and preventive care. Patricia Williams, the security guard whose daughter had deferred medical school, began crying. Mr. Blackwell, does this mean? It means your daughter can start medical school next semester if she wants to. Full scholarship, plus living expenses. We need more doctors who understand what it means to serve others, and I have a feeling she learned that from watching her mother. The legal battle that followed was intense but brief. When the news broke about Marcus's personal funding of salary increases and the employee ownership plan, public support became overwhelming. Patients began choosing Blackwell hospitals, specifically because they wanted to support a healthcare system that valued its workers. Other hospital systems found themselves under pressure to match the new compensation standards. Most importantly, the employees themselves became the most powerful advocates for the changes. They organized rallies, spoke to media outlets, and demonstrated a connection between worker welfare and patient care in ways that no corporate PR campaign could match. The investors who had tried to remove Marcus found themselves increasingly isolated. Stock prices, after an initial plunge, began recovering as analysts realized that the employee ownership model could actually increase long-term profitability by reducing turnover, improving patient satisfaction, and attracting top talent. Thomas Wright, Marcus's former friend who had led the opposition, requested a private meeting 6 months after the transformation began. "I owe you an apology, Marcus," he said, sitting in the same hospital conference room where the battle had begun. "I thought you had lost your mind. I was wrong. You found your soul." The results spoke for themselves. Employee turnover dropped by 70%. Patient satisfaction scores reached all-time highs. The hospital system began attracting the best medical talent in the country, drawn by both competitive compensation and a mission-driven culture. But the most meaningful changes were personal. Maria moved her family into a beautiful 3-bedroom house, the first home they had ever owned. James was able to quit his 2nd and 3rd jobs, spending evenings with his family for the first time in years. His brother Miguel received the insulin he needed and was thriving. Dr. Chin paid off her student loans 5 years early and established a free clinic in the hospital's community outreach center. Marcus himself moved out of his $40 million penthouse and into a modest home in the same neighborhood where many of his employees lived. He discovered the joy of knowing his neighbors, of shopping at local stores, of being part of community rather than ruling over from above. 1 year after his heart attack, Marcus returned to the cardiac unit for his annual checkup. Dr. Chin pronounced him in excellent health, but she also noted something else. "Your stress levels are lower than I've ever seen them," she observed. "Your blood pressure is perfect. Your heart rhythm is strong and steady. Whatever you're doing, keep doing it." "I'm doing something I should have done years ago," Marcus replied. "I'm living like a human being instead of a profit and loss statement." As he walked through the hospital corridors, Marcus was struck by how different everything looked. The floors were still the same, The walls were still the same color, but the atmosphere was completely transformed. Employees smiled when they saw him. Not the forced smiles of people afraid for their jobs, but genuine expressions of respect and affection. He stopped by the nurse's station where Maria was working the day shift. She had been promoted to charge nurse and no longer needed to work nights. "How are the kids?" he asked. "Thriving," she replied with a radiant smile. Sophia made honor roll. Miguel is playing soccer, and little Carmen wants to be a doctor when she grows up. She says she wants to help people like Dr. Chen helped you. "And how are you?" "I'm happy, Mr. Blackwell. Really, truly happy. For the first time in years, I'm not worried about money or housing or whether I can afford to take my kids to the doctor. I can focus on being a good nurse and a good mother. That's all I ever wanted." As Marcus continued his walk through the hospital, he reflected on the journey that had brought him to this moment. A year ago, he had been one of the wealthiest men in the state, but one of the poorest in spirit. He had commanded respect through fear and accumulated money through the exploitation of others. Now he was still wealthy, though considerably less so after his generous restructuring of the company. But he had discovered a different kind of wealth. The wealth that comes from knowing that your success lifts others up rather than holding them down. The wealth that comes from being genuinely respected rather than merely feared. The wealth that comes from building something that makes the world better rather than just making yourself richer. The transformation wasn't complete. It never would be. There were still challenges to face, still improvements to make, still people to help. But Marcus had learned that transformation isn't a destination. It's a way of traveling through life. And for the first time in decades, he was excited about the journey ahead. As our story comes to an end, Marcus Blackwell stands in the lobby of Mercy General Hospital, watching the evening shift change. Nurses, doctors, technicians, and support staff move through the corridors with purpose and energy that wasn't there a year ago. They're not just employees anymore. They're owners, partners, and valued members of a community that recognizes their worth. The transformation of Blackwell Medical Group became a case study taught in business schools across the country. Not because it was a perfect model. There were setbacks, challenges, and ongoing struggles, but because it proved that businesses could be both profitable and humane. That success didn't require the exploitation of workers. That the most sustainable competitive advantage was treating people with dignity and respect. But the real measure of success wasn't in the business journals or the improved financial metrics. It was in the lives that were changed. Maria Santos now owns her home and has started a scholarship fund for single mothers pursuing nursing degrees. Her daughter Sophia is studying pre-med at the State University, inspired by the doctors who cared for Marcus during his recovery. Dr. Sarachin opened her free clinic and has treated over 3,000 patients who couldn't afford care elsewhere. She's also engaged a fellow physician she met at a medical conference, something she never had time for when she was working 80-hour weeks just to pay her student loans. James Rodriguez became the head of facilities management for the entire hospital system. His brother Miguel is healthy and working as a diabetes educator, helping other patients manage their condition. James's son graduated from college debt-free and is now studying to become a hospital administrator, inspired by the changes he witnessed in his father's workplace. Patricia Williams' daughter graduated from medical school and is now completing her residency in pediatric cardiology at Mercy General. She plans to specialize in treating children from low-income families, understanding firsthand how financial barriers can affect access to health care. And Marcus? He remarried, not to another wealthy socialite, but to Elena Rodriguez, a social worker who had been advocating for hospital employees' rights long before his transformation. They live modestly, travel frequently to visit other hospital systems interested in implementing similar employee ownership models, and spend their evenings volunteering at the community clinic. Marcus's net worth is now a fraction of what it once was, but he's never been wealthier. He measures his success not in dollars accumulated, but in lives improved, not in power wielded, but in dignity restored, not in fear commanded, but in respect earned. The heart attack that nearly killed him actually saved his life, and the lives of thousands of others who benefited from his transformation. It taught him that the most valuable things in life can't be bought, sold, or traded on any stock exchange. They can only be earned through genuine care for others and the courage to do what's right, even when it's difficult. But here's the most important part of the story. It's not unique to Marcus Blackwell. Every day, in businesses and organizations around the world, people in positions of power have the opportunity to choose between profit and people, between efficiency and empathy, between personal gain and collective good. The question isn't whether transformation is possible. Marcus proved that it is. The question is whether we have the courage to examine our own lives, our own choices, and our own impact on the people around us. So I want to ask you directly, what would you do if you were in Marcus's position? If you discovered that your success was built on the struggles of others, would you have the courage to change? And more importantly, what power do you have right now in your job, your community, your relationships to make someone else's life better? Maybe you're not a billionaire CEO, but you might be a manager who could advocate for better working conditions. Maybe you're not running a hospital system, but you could volunteer at a local clinic. Maybe you can't restructure an entire company, but you could mentor someone, support a colleague, or simply treat the people who serve you with greater respect and appreciation. The truth is, we all have more power than we realize to make a positive difference in someone else's life. The question is whether we'll use it. Marcus Blackwell's story reminds us that it's never too late to change, never too late to choose compassion over profit, never too late to build something that lifts others up instead of holding them down. But it also reminds us that transformation requires more than good intentions. It requires action, sacrifice, and the willingness to fight for what's right even when it's costly. If this story moved you, if it made you think about your own life and choices differently, I want to hear from you. Share your thoughts in the comments below. Tell us about a time when someone's kindness changed your life, or when you had the opportunity to help someone else. Let's start a conversation about how we can all be a little more like the transformed Marcus Blackwell, and a little less like the man he used to be. And if you want to hear more stories like this, stories about redemption, transformation, and the power of human compassion, make sure to subscribe to this channel. Hit that notification bell so you never miss a story that might just change the way you see the world. Because here's what I've learned from researching and telling stories like Marcus's. The world is full of people who are capable of extraordinary kindness, remarkable courage, and incredible transformation. Sometimes they just need to be reminded of their own power to make a difference. Thank you for taking this journey with me today. Thank you for caring about stories that matter, for believing in the possibility of change, and for being the kind of person who wants to make the world a little bit better. Remember, you don't have to be a billionaire to be wealthy. You just have to care about something bigger than yourself. Until next time, keep believing in the power of transformation, in others and in yourself.